there was this idea and notion that like youth mental health was like a specialty zone and that whatever we were just doing for adults, we could just do that for young people and like that was going to be fine.
You cannot just deploy an adult intervention in a youth population. The person who is 30 is much more like someone who's 50. The person who is 16 is not even really like a 13-year-old. Meet Dr. Amber Childs, an associate professor of psychiatry at Yale School of Medicine and the chief clinical officer at Somethings.
When I was facilitating a psychotherapy group, we'd have all these other teenagers there. And I would be like, oh, that really hit. That was good. And the teen would be like, you know. And then another teenager in that group would say a version of what I had said. And that teenager would be like, oh, there's something about this person who's had a similar or adjacent experience, interpreting that back that is bearing a significant weight for that person that I would never be able to do myself.
Sometimes the right message doesn't get through that filter just because the person's not really open to it. And if you get the message from the right person, they might be open to it.
There is that initial film on the top of like, I'm gonna tell somebody that I'm not feeling good and that I don't know why. And like admitting that is could be really distressing because they felt like they should be able to handle it on their own. They worried what other people were going to think and they didn't want to be a burden.
How do we actually deploy human connection? How do we manufacture connection in a society that is so disconnected?
I don't know if we can manufacture it, but what we can do is we can create.
My guest today has spent nearly 15 years working on one question. How do we actually get young people the mental health care that they need? Dr. Amber Childs is a licensed clinical psychologist and associate professor of psychiatry at Yale School of Medicine and a member of the medical staff at Yale New Haven Psychiatric Hospital. She is a serial founder, award-winning innovator, media contributor to the New York Times, Washington Post, CNBC, CBS, and many, many more. And as a Yale University Public Voices Fellow and is a frequent contributor to peer-reviewed literature with over 50 peer-reviewed manuscripts and presentations. That's a lot of presentations.
Thank you.
She's currently ambassador for the American Academy of Pediatrics Center of Excellence on Social Media and Youth Mental Health and an appointed member of the Forum on Child, Youth, and Family Wellbeing of the National Academies of Science, Engineering, and Medicine. What I specifically appreciate about Amber is that she sits at a very rare seat combining academic expertise with actual real-world deployment of products and services for youth and people in mental health. And she's very vocal about answering the surging youth mental health needs in lots of different ways through technology, through connection, and equally vocal that if anything clinically unvalidated keeps proliferating to cause harm, we're going to lose public trust in actually being able to innovate and driving new things for people. So thank you for being an advocate. I'm so excited to talk today. Amber, welcome to the show.
Patrick, thank you so much for having me. And it always fascinates me to hear people read about my bio. And I think like, oh my gosh, these are all the different spaces that I'm playing in. But one of the things that I hear as I'm listening to my bio is so much alignment with you and your work. And so I'm just thrilled to be able to have this conversation with you. I'm excited about what we're going to get into.
Let's do it. I always like to start by just hearing about people's backgrounds because like the work that you are doing is amazing, but like something has driven you to do this work. So like what drew you to psychology? Why did you get into the space? What drew you to the work you're doing today?
Patrick, I didn't even know about psychology as a discipline until I was already in college. So I always say to people, you know, I'm a Black girl from Georgia. I grew up in Middle Georgia. I grew up in a military family. And shout out to my family. If you're watching this, love you so much. But in my school and in my hometown, psychology, emotions, feelings, sort of getting curious about the inner world and the inner self wasn't something that was very common. I think that the thing that would have been most adjacent to that was more of a sort of faith-based spiritual community approach. And so I hadn't actually even considered some of these different notions or concepts or ideas academically until I was in college. And then from just like a personal standpoint, I felt very one note in terms of emotions. So I didn't feel like there was a lot of emotional curiosity that I was encouraged to explore as a young person. But when I was in undergrad, I had this idea that I was going to be an international interpreter because Nicole Kidman had just been in a movie called The Interpreter. And I thought, oh man, that looks cool. That looks awesome. That's very fast paced, like bing, bang, boom. I enrolled in these courses called intercultural communication in undergrad. This amazing teacher William Fox, Dr. Fox, he has now like an gorgeous sleeves of tattoos. He was so cool. He was a social psychologist. The first thing he did was he like went over to the whiteboard and he wrote down this quote from Michel Foucault, which makes me sound super cultured. So I love telling people this. What if what you believe to be true might be otherwise so? And that's how he introduced these really layered conversations about language and about how people use language in culture and in context. And he talked about his work in the Pennsylvania mines and how Pennsylvania mining culture had all of these idioms in this language that connoted significant emotionality and was a way to process the trauma of working in those mines. And I remember talking to him all the time after class. At one point, he was like, I think you might want to be a psychologist. I think you're really interested in like, what if things are very different than how we've thought about them? And you have a very curious mind and heart. And so that's how ultimately I learned about the field. And then I realized like, there's a lot of different layers to this. Adults were making me feel just downtrodden. So like when I and maybe this was like I was in my own sort of late adolescence and early young adulthood at the time, and maybe there was a bit of fearfulness about what that meant to fully step into adulthood. But I was like, the idea of working with adults feels unbearable. It feels like things are so etched in. That's very much not how I feel now, but I felt like there was a hopefulness about youth and young people and children. There was like all of this untapped potential and all of this like unknown. And I think you've even said earlier today in some of our conversations, this unknown canvas. And that to me felt very life-giving. And so that's how I thought about psychology. And that's how I ultimately ended up beginning to work with children.
Were there any like clinical or educational experiences during this time that made you realize that? Like, was working with kids, did you realize this? Or what caused you to kind of understand that about yourself?
Well, the first thing was my mom tried to get me to watch like One Flew Over the Cuckoo's Nest. And she was like, this is what it's going to be like if you work with adults, which is a funny story, but also did encourage me to think, oh, actually, if you do some of this work, you could focus on specific populations. I think if I'm honest, I think it was an opening in a lab working on early detection of autism in 2-year-olds. Number one, the lab was open for like new recruits. But then when I went in and I started to think about what might it be like for these parents to come in and they've got this evaluation screener from their pediatrician that's telling them that something may be different about their child that they need to address, but they might have been thinking that things are not quite right. Or maybe, they've had some fearfulness about it and they're getting curious about it. What is that like to share space with them, to help and support them? And so I think some of the early work in that lab steered me in that direction. But really, I think I probably always had this draw toward trying to understand young people. And I remember in the 4th grade, I used to be like the kid where teachers would say to my parents during parent-teacher conferences, like, we're going to sit this kid at Amber's table because she just has something happening where like he's listening to her or, she's having conversations with him and then he's sharing things that he's not sharing with other people. So I think there was like something about me that was like a container too that happened early on.
It's so interesting. I feel like anyone who's a parent, which I'm not, but anyone who's a parent has the experience of like having child who have personalities like in the first year or even just like right out of the box. And it's like, oh yeah, some of this stuff like really is in there. And like, I'm not surprised at all to hear that like your level of magnetism has been around you since early age. So not surprised. I imagine going through like a long formal education in psychology, you learn a lot about people's theories, you do a lot of practice. When did you start formulating your own theory about mental health or psychology in the way that has allowed you, I think now, because you do so much interventional work, like when did you start developing your own theory about how some of these things work?
I watched James Baldwin recently. Do you know James Baldwin? Okay, he's an incredible poet, author, writer, advocate from the 1960s. And he's a Black man. And he was having this conversation with, it wasn't Angela Davis, but it was another incredible author, writer. And he said something like, he was like, when I was young, I used to think I knew everything. And I had so many ideas and I had so many different theories. And now the older I get, the more I've learned that I don't know a lot. And it's a great relief. So what I would say is like something like that. I think probably I did have early notions about what early childhood experiences meant. And I think there is some literature that supports that. And I probably had like some crystallized theory about what it meant to live well and be well and experience vitality in the world. And the older I've gotten, the more I've realized how complex that is. So I would say, I think my theories are still in development. But what I can say has stuck around is this idea of the importance of the context and all of the Bronfenbrenner circles around people that help us to explain and understand what's at the center. So I guess I'm saying the waters that we're swimming in are really, really important to the ways in which we're able to be expressed in the world.
I mean, we're social animals. It's it really does work that way. And your psychology is not only dependent on the family unit that you grew up in, but also the social context that you launched off into adulthood. And I imagine for children, it's even more pronounced because kids are learning as they go. They're learning in the social context. They're trying to understand what behaviors are normative, what behaviors are not acceptable.
Have you ever had this experience, Patrick, where, you've met someone and then you're like, I never knew you were like this until you saw them in a dynamic with another person where you were like, wait, this is a whole new thing. I didn't even know you had this. That was always part of their core essence, but the context has now shifted in a way that has allowed that to express itself. And that's a very basic example, but I think about that in terms of even kind of structural and systemic analysis too, where there are these core parts of all of our essence that gets expressed or unlocked or not expressed and unlocked based on the system that we're in, the structures that are there. Some of it could be the relationships that we're in. Maybe it's a school setting, whatever it might be. But maybe that is part of what my theory is everything is very contextually grounded.
I mean, as someone who's gone through a mental illness, I've experienced that for myself, which is discovering parts of myself that I didn't even know were possible through different social contexts or different, just honestly, cognitive states that are not so mentally constrained. And it's fascinating to see how you put someone in the right context, what is much more aligned with where this was be, and they bloom all of a sudden. And it's whoa. And you pull them out of that context and then it goes away.
Yeah.
Right? I think there's a lot more going on in the way that our brains are processing our environment than we give credit to. Probably a much longer conversation to talk about. I guess what are the areas of psychology, mental health research, interventional psychiatry that you resonate with, at least in the youth population, or you feel in your experience has been really resonant with how you've experienced the world?
Interpersonal connection. And I think that's very basic, but I would say that I'm a very relationally oriented person, both in terms of the theories that I'm interested in, the methods and modes of practice are very sort of relationally oriented. What's happening between you and I right now, this moment that we're sharing exists nowhere else in the world because you're bringing yourself and I'm bringing myself to it. And that feels like a really powerful, important part of just humanity, but it's also very curative and comforting. And there's so much opportunity to be interventive in that space. So I'm always interested in any kind of intervention, any kind of way of thinking that indexes on how connection with other people helps us to move into wellness. I was listening to an interview recently where someone, I think her name is Anne Lamott. I want to say Lamont, but there's no N. And she was saying something when she's just feeling so down and so anxious and so upset, there's nothing else that works for her except talking with another person about it or laying on the couch with another person or asking, getting her a glass of water, a glass of tea. There's something about that feels important. So it's almost getting back to basics. What can we do about relationships? And then you can fancify that in a lot of different ways. But
yeah, I'll tell the story. So my most recent therapist, she would hate that I would tell you the story, but I'm not going to name her, so it's fine. We worked together for 6 months.
Tell it. This feels very juicy.
Well, it's relevant. We worked together for 6 months, and we were getting nowhere just because I was not really opening up to her. And at the time of my life, it was very hard for me to open up still.
Yeah.
And she tried to break up with me. She was like, if you're not going to open up here, what are we doing? Why are you paying me? Why are you keep coming? And I told her, I was like, why would you be the first person who I would ever open up to and feel trusted enough to actually open up with whatever's going on? And she was like, that's why you pay me. That's literally the whole reason why we're here. And my question for you being is in that moment, I realized I was the element of the social dynamic here of me, my inability to even open up and connect with someone on what I'm going through is a big part of this blocker in my mental health journey. How much of the pure social context of working with someone in a mental health context, like how much of the intervention is like just the social dynamic, as opposed to like we're delivering EMDR, or we're delivering CBT, or any sort of like, evidence-based. How much of it is just like the relational context?
Well, I'm going to tell you like what the research says, and the research would say, even though it's kind of like OG research and we need to refresh it at some point, the relationship, the therapeutic alliance, as some would call it, is like responsible for the most prominent effect sizes, which for folks who are listening to this, they all know what an effect size is, but essentially it's like the strength of the intervention itself. A lot of it rests on that. But what I would also say is like the shape of the relationship and the quality of the relationship, it doesn't necessarily have to be that we are like interacting or talking with each other to still be in relationship. Some of it is just like being able to be witnessed by someone, stepping into a space where there's like that relational container. And I would say like even you're just showing up to those sessions on a weekly basis, even if you were doing exactly what you could do at that time, which was like, I'm still coming here, is still being in relationship with that person, right? Like there's still something that's there and that's happening. And then enough happened, like inserted something in there where she was like,
Gave
hold
me
on,
some irreverent voice and it really worked.
Yeah. What I would say, all of the interventive work is that relationship, which to me is a humongous unlock, because what it means is that it doesn't just have to be licensed clinical psychologists or social workers engaging in something that is curative. It can be any number of people who can offer up that relational foundation that can be really transformative for folks.
Yeah. I find in the journeys of a lot of people, including myself and others that I've talked to anecdotally, a successful exploration into your own mental health is going through the process of identifying what is going on, which often when you start, you have no idea. Like I think a lot of the kids that we serve have this experience of like, I know I feel bad. I don't know what it means. I don't know what's going on, and I don't know what to do. And like just being able to navigate through that process is like, you kind of can't do it alone. Like, because if you could do it alone, you probably would have already gotten out of that spot. So yeah, like just the social context of having people in your life, having people in your community, which like unfortunately it's just gone today, means that I think a lot of people don't have that.
It also feels kind of risky though, too, don't you think? There's a piece of like core vulnerability and having to like, when you get like a new Jell-O, and you take off you probably haven't eaten Jell-O in a long time because you're not 7.
No, because like the tinfoil top, yeah.
You're not 7 or whatever. And I have an 8-year-old, so I've got Jell-O in my house. But there's that little like light film on the top. You have to like break into that like thing. And then you're like, oh, now this is like so delicious. Yeah. There is that initial like film on the top of like, I'm going to tell somebody that I'm not feeling good and that I don't know why. And like, I don't understand anything about anything. And like admitting that is very it can be really distressing.
Yeah.
So there's like a risk in trying to be witnessed by other people. And I think actually a lot of teens say this, like there's some SAMHSA data that talks about this, that teens are, when they feel like they should get support, but they don't get support, especially for teens who had like a major depressive episode, they'll say because they felt like they should be able to handle it on their own, they worried what other people were going to think and they didn't want to be a burden.
Yeah. That's the thing we heard is like, especially for parents, a lot of kids did not want to be a burden on their parents because they felt like their parents were working so hard for their own selves and then for them. Like it was almost like how can I add more to their plate? Which is like, man, a 14-year-old feeling that way is so sad when you think about it, but it's really how they feel.
Yeah, but you see that 14-year-old sees their mom running around, eyebrows are flying off, they're doing a million things, maybe they're working several jobs, maybe there's other folks in the home who are struggling. So we both know and understand that the relationship is so important. It can be so curative, it can be so interventive fundamentally, but then there are all these things that get in the way of us being able to take advantage of the relationship and like, do the things.
Yeah. So you've pretty much been in the field for as long as things have gone off trend now. Like 2007 was kind of the first year where things got off. Like what have you observed when it comes to just the state of youth mental health? Like obviously you've seen the data, I'm sure, but have you seen it in your work that the issues have gotten worse? If you have, like, help us understand.
I've never not seen it. It's so true. So I never was practicing during a time when it wasn't already a heightened sense around youth and young adult mental health. When I first started what I felt like was my real big girl job as an intern, but y'all, I was an intern, how precious. And I really thought I was somebody too. I had my badge and everything. You could not tell me anything, but I was on a psychiatric inpatient unit at the Institute of Living in Hartford. I am so grateful for my training there. It was not perfect, but it was a really important experience for me. And I remember a lot of the other OG clinicians being like, this is the worst we have ever seen this. We were having youth that were cycling in and out of the inpatient unit with regularity to where like they knew staff and other folks there. They were really familiar with the grounds. And within that short period of time, my experience was people were like, the acuity has increased so much among our sickest youth. And I remember my training director saying, like, you will never see the time when it wasn't this bad.
Wow.
And so that's the space that I really entered into.
And was this low income youth? Was it a cross cutting of like racial, ethnic, financial background, or
it was cross cutting? It was a hospital system. And so we would often serve many individuals who were accessing services using Medicaid insurance. And so we would absolutely see, disadvantaged and high potential communities, I like to say, coming through. But we were seeing, really affluent folks. And there was just a real sense that things were really difficult. So look, I was writing the treatment plans and I was saying, okay, your child has been with us for 7 to 10 days, which is a really horrifically short period of time, even though I'm all about like least restrictive environment. I want to get you back into your community as soon as it's safely possible to do so. And then I would say, okay, here's like, 5 clinicians that you can contact. And I've already called like 2 of them and they're going to be able to get you in like 12 weeks from now. And that's like the fastest we can do. So what we're going to do is we're going to bridge you with emergency mobile psychiatric services. We called it EMPS, which what I was literally doing, Patrick, is I was saying, I have to discharge you from here. And I know that you're not going to see someone for 12 weeks. And let's hope to goodness that there's a relationship and a connection and an alliance that you can develop with that person. But in the meantime, we're going to put the emergency services around you to bridge you. And that's literally what it has been from the beginning. So the shortages have been there and they have increased over time.
Okay. So
I know, how distressing. It's really hurtful. I don't like talking about it.
When did you start identifying this as a problem that you more broadly wanted to solve? Because you've dedicated the greater part of the last many years of your life to solving it. This sounds like it was probably an impactful experience for you, but like, when did you start thinking like, wow, I gotta like get involved here?
Yeah. Well, first I thought, okay, well, what do we do here to like get more providers? It took me 1,000 years to go through that training, Patrick. So I treated my training like a startup, right? I was like, I don't have money to be in here for 5 years, like thinking my thoughts. I'm getting through this program in 3 years, which I did do. I'm defending my dissertation before I apply for internship. So I got to get out of here like as fast as possible. And I was like, there's no other people who are getting, there are some people, but to be able to get to this level of training that quickly, we will never be able to catch up the number of people who need to be trained, even if they're all doing their PhD like a startup, right? What if we can get master's level clinicians? Like the volume is not going to be addressed just by increasing like the number of providers. And I had one specific moment with a teen. I might cry when I talk about this because I really feel this work so deeply. But there was a young man who came into our intensive outpatient program. I was doing ambulatory services and doing program redesign there. And, I'm a Black woman psychologist, really highly trained. And I'm not saying that to massage myself, but to just say like, there's not a lot of folks who are doing child and adolescent psychology, not a lot of Black women doing it, not a lot of folks working within the Yale New Haven health system doing that work. And he came in to the program and he was like, I really wasn't going to come. And we were in the room by ourselves and I was doing the intake. And he goes, but then I came in here and I saw this. And he's pointing to my skin. And I was like, oh. And he goes, because you're going to be able to feel what I'm saying to you. And then he goes, I might drop some tears right now, but I didn't think I was ever going to see anybody like you.
Wow.
And I thought to myself, okay, I can't clone myself, but I have to find some way of expanding this work above and beyond the idea of just getting more Ambers and more providers. That's absolutely part of it. But how do I work with tremendous pace to begin to think differently and innovatively about how we can get these services to more people like this person? So this is one of the last people that says to me, I never would have imagined that I would have had something like this.
Wow. It's amazing how just the element of like, I believe that you can understand my experience, how important that is to a therapeutic alliance, or just like taking a step. Because if I have the belief that you're not going to understand, then I'll never even get to the point where I'll even try to like explain what's going on. And I don't know the statistics of the sort of racial makeup of licensed professionals, but I can imagine that it's not representative of the actual population.
Yeah, that would be a very good guess. And look, I'm not going to say that you have to have a racially matched clinician or that your clinician has to align with you on every identity marker. That's actually not what's true. My therapist was like an old school boomer Jewish lady who was awesome. And we worked together for many, many years. And I remember having to explain to her like why it takes me 3 hours to do a blowout. And I was like, girl, if I had a Black therapist, I would never have to explain this. But we did really, really impactful work. So I don't want to diminish that. But the core of what you're talking about is actually true, which is like, if I don't see that I would be reflected back in you in any way, or that I could connect to you in any way, it would be really hard to break that Jello layer that we talked about, in the beginning and take that vulnerable risk of beginning to explore what some of these tender pieces might be.
Yeah. Okay. So it sounds like clinician shortage has driven you to the space of trying to identify ways to bring more folks in, which very noble, very important problem. What are the solutions? But
also the other thing that I would say too, Patrick, is pace. So sometimes people will say like, okay, what do you think is the biggest problem that we're trying to solve? And I wouldn't say to you that the biggest and only problem is the shortage. It is a huge problem. Like it's just so multifaceted. But what I would say is like, I think the biggest problems that we're working on is like working at pace. We got to work at pace. And the other thing I would say is priority, because for a while there was this notion that like youth mental health, young adult mental health was like a specialty zone. And that whatever we were just doing for adults, we could just do that for young people. And like that was going to be fine. So if the question was around increasing access, reducing shortages, even creating some digital innovations, well, we're doing all that already, right? Like look at what we're doing over here for adults. Why would we do some sort of specialty niche thing for youth and young people? So I think pace and prioritization are two other problems that have to get solved.
Yeah. I mean, just to interrupt there too, that was one of my observations when I first started Some Things was like, you cannot just deploy an adult intervention in a youth population. Like there is a fundamental difference in that kind of population, this person that is a 16-year-old, than somebody who's 28 or 50 or 70. And like the person who is 30 is much more like someone who's 50. The person who is 16 is not even really like 13-year-old. Like they're so different. So interesting to hear you say that as well.
Oh, 100%. Well, so I guess in terms of like, what are the solutions? Well, maybe the other thing we should just say, and I think that we're talking a little bit around this, at least my mind is thinking about it, the context, right? We've got AI, we've got social media, we've got like all this digital engagement that's happening for folks. Like there's we've got wars and like a lot of things happening and playing out on our national stage. There's like a million things happening, right? So the context is tremendous. And that's, I think, part of why we're seeing acuity rise. It's not just in the shortages and access and all those other pieces. But what do we do about this? I actually, Lord, I spend a lot of time thinking about this because I'm like, what can we do as fast as possible with as high impact as possible? For a while, I had tricked myself into thinking like, there's going to be some sort of like technological innovation or revolution that's going to be able to help us like fight fire with fire against all this stuff. But what I've come to really realize is it's actually back to the most basic fundamentals that are at the core of who we are, which is like relationships and connection and, being able to be witnessed. So my thought is like, what can we do to use technology or use innovation or think differently about care models that really center connection and embeddedness in the community for folks? Those, I think, are part of a multi-pronged solution.
Yeah. I've gone down the rabbit hole as well of like, could AI like truly replace a therapist? This is a bit of a tangent, but even if you think about the way that LLMs or AI today is designed as, it essentially works a lot like cognitive processing. It's like taking an input, processing it, evaluating the process. It's very like cognitive. And as we were talking about earlier, so much of the therapeutic alliance is not cognitive. It's social. It's probably emotional. It's probably much lower in our brain system.
Mm-hmm.
So my logical conclusion is to have a therapist that actually, like an AI therapist that can actually do AI therapy, means they have to experience emotions too, because they have to be able to experience the feeling of people. And I think our society has a lot of unique new challenges if we develop that technology, which I'm not super excited about or hoping that comes that soon.
I think we've made the point that like we feel really good about connection, all these pieces. So I think we were rounding the circle on like how important relationships are and how even though they feel very fundamental and basic, there are ways that we can be innovative and creative about designing for that for folks.
How do we actually deploy human connection? How do we manufacture connection in a society that is so disconnected?
Well, first of all, I don't know if we can manufacture it, but what we can do is we can create like a pathway or a mechanism that helps us to unlock connection. So people used to think about this way back in the day, right? I don't know if you remember MySpace or not. Or no, actually not MySpace. Let's do Zanga. Did you ever know about Zanga?
Was that like the Facebook games? Or am I thinking of something
Patrick,
else?
how
No,
dare
I'm
you?
sorry. I'm
No.
Gen Z. So
How dare you? Okay, so it was basically like there's this blogging website, but basically there was a website that you could post different thoughts or ideas that you might have. People could comment on them, respond. You'd put like a really moody song in the background to connote that like I'm like in my feelings right now and like all is not well. But it was a way of like sharing and exchanging information. So the point is like there was technology, there was a platform that then created this opportunity for people to exchange ideas and information. So it's kind of like basically the idea of the internet, right? So I think about that at its core and think like, what are the ways that we can be using technology if we're using AI? How can we use that to help us surface or help people identify places where they can connect within their community or places that feel identity aligned? Maybe it's like a specialty population that wants to connect with, individuals who identify as LGBTQ plus, but have this specialty interest over here in like, I don't know, what are people interested in? Dungeons and Dragons. I'm making this up. Like
anime.
Whatever it might be, right? Like all the things about ourselves that we're interested in. How do we use technology to actually prop up the things that we are naturally interested in doing as humans? When telehealth was happening way back in the day as like an OG thing, it felt very revolutionary to be like, wow, this technology is actually helping us to do the thing that we would have been doing ordinarily, but now I can actually connect with a therapist who I wouldn't have had access to because they are on this total opposite side of the state. But now I can access that person. And now this is like increasing the opportunity for me. So sometimes when I hear innovation, I think people think it always has to mean technology. It doesn't have to. But in this case, I'm really interested in what are the creative innovations we can use that help us to prop up just being in connection with each other.
So what are you excited about right now?
I'm excited about peer support, which sounds planted, but I promise you it's not. And actually, before I even met you, Patrick, because people will know that you do work at peer support, right?
Yeah, most likely.
Before I even met you, some colleagues of mine at Yale over at the Connecticut Mental Health Center, they've been doing work for decades in peer support. And I first learned about peer support when I became the director of training for the psychology doctoral internship at Yale. And, 7 years ago, I was in a seminar for our trainees learning from Dr. Sherelle Bellamy, Dr. Larry Davidson, pioneers in documenting peer support, which is like, I am a person who has a lived experience of mental illness. I'm a person who has navigated these systems. And even though we are in this context of all of this incredible expertise, we've got the psychologist, we've got the psychiatrist, we've got all of these different individuals on your care team, we've realized how important it is to be in recovery, that you need to be connected to other people who have been where you are and know your experience. And at the time, I was doing a lot of work in group-based services. And I was noticed after these sessions, right? I was like fully in a learner, even though I was directing that program. I was like, no, let me learn about this. Let me find out what's going on over there. I was doing group-based services and I started to recognize so much more clearly. I would say something to a teen when I was facilitating a psychotherapy group, and we'd have all these other teenagers there. And I would be like, oh, that really hit. That was good. That was like in my mind, I'd be like, oh, she really got into it. Clock it. I'm like, I'm all over it. This is going to be wonderful. And the teen would be like, And I'd be like, okay, well, let's, and then I'd be like, okay, like, no, it's all as well. Like, keep trying. And then another teenager in that group would say a version of what I had said. And that teenager would be like, oh, I never really thought about that before. And I'm like, at first I was like, well, that is, right internally, I'm thinking that. But actually, I was like, oh, the phenomenon that I'm witnessing right here is important about group psychotherapy, which is different than peer support. But I was like, there's something about this person who's had a similar or adjacent experience, interpreting that back, that is bearing a significant weight for that person that I could never be able to do myself. But how powerful is that? And then I was like, oh, if that can happen in this group, now we're talking like 10x, now we're talking 20x, now we're talking multiples, right? So that's when I started to really begin to learn more about peer support. And then I learned about the work that you're doing, which is incredible in the space, and I think really going to be transformative. But
one of the early moments where, because I sort of stumbled upon peer support after learning and doing interviews with kids about what they wanted from mental health services, and learning they were like, I want to talk to someone who looks like me, talks like me, has done this. So I kind of came the other direction of like, I didn't even know that this was a thing. And I early on, when I was talking to kids, one of this, I can't remember how old she was. I think she was like 16 or 17. But one of the things she told us was, I have a psychiatrist, a therapist. I talked to my mom and my sibling and about all this stuff. And she had one of our mentors, of our early mentors. And she was like, they could all be saying the same thing. My psychiatrist, my therapist, my mom, my sister. But if my mentor tells it to me, I'm going to listen to it. And I was like, I kind of get it. You know, it's like the dynamics of each of these relationships matter so much in terms of the delivery of the mechanism. And I think it's like you talk about like the Jello filter of like being able to express stuff. It also goes the other way, right? It's like what gets through the thin Jello filter. Sometimes the right message doesn't get through that filter just because the person's sort of like not really open to it. And if you get it, the message from the right person, they might be open to it. So that was when my eyes really opened up. I was like, oh, this is really interesting. So it sounds like you had those experiences. Like, I'm assuming since you're a very well-researched and very informed academic, you probably did your research too. Like, what did you find when you started looking into the space from like a research perspective or an interventional psychology perspective?
Well, at the outset, I was like, wait. We're getting outcomes here that are like similar to some psychotherapy outcomes, right? Like the peer support that I was first learning about was peer support in substance use recovery and in adult populations, right? So in some of the work that was happening at the CMHC was really around supporting individuals in long-term recovery from severe and profound mental illness. So these are folks who are embedded in their community and their peer support relationships for many, many, many years. And I was like, wow, the outcomes here around retention in recovery are like blowing me away. I mean, so I'm like a data person, right? I'm putting in all the data systems over in our adolescent IOP. And I was like, wait a second, could we say that we're having similar outcomes to these long-term recovery-oriented outcomes that we're seeing in peer support? I don't know. I mean, certainly we're having short-term impact, absolutely. But it did give me some hope when I was seeing those early data. Now, I do think that there's a lot of, the work is emerging in youth peer specialist support in particular. And I think it's important for people to understand, and I'm sure you've done some of this work, and folks like Kelly Davis at Mental Health America and others have put out significant research that talks about the whole continuum of peer support. But when I'm talking about it in this context, I'm really thinking about peer specialist support. The work is building in that regard on peer specialist support for youth and young adults, but there's a lot that we still need to do there, right? There's a lot more work around how do we measure what these outcomes look like? Because it's not just measuring symptom-oriented recovery. How do we think about some of the pieces of role clarity and what the boundaries and things like that are looking like? How do we think about what are the core elements of the relationship that really drive the change that we see? So we started talking at the beginning about therapeutic alliance, for example. Some of the things that peer mentors and peer specialists are doing, they're doing very boundaried strategic self-disclosure. There's evidence-based strategies around, validation, some non-directive support that might be, emotional support, just witnessing the person. It might be more instrumental support, providing information. So there's still some work for us to begin to really evaluate and understand what those mechanisms are. But I'm the type of person who's like, look, we also have practice-based evidence, right? Like we've been out here seeing it do what it does in people's lives. So I don't want to diminish that either on behalf of some of the empirical work that still needs to happen.
Yeah, I'd feel the same way. And like, I think compared to something like a CBT-based intervention, like there's just decades that traditional clinical interventions have on the field of peer support. So it's exciting to be on the fronting edge and the cutting edge. And sometimes I'm like, man, we need more. And I think the field of peer support is so kind of ill-defined still. And I sometimes wonder even if like peer is the right like broad umbrella for the kinds of things that fall under it. Not my decision to make, but there's so many different kinds of things that you can do within.
Don't try to make a name change. I'm hurt. I'm sore about measurement informed care versus measurement based. Like there's a lot going on with naming.
Healthcare is fun with naming. Anyway, lots of different kinds of things that you can do. And I think like the way you deploy a peer also matters to the impact you're trying to have. Like a peer as part of a care team for eating disorders has a very different slated impact than a peer doing in community crisis intervention versus a peer doing in school, academic, and like there's lots of different things you can do. We could probably talk for hours and hours and hours on this, which we will, because I'm very excited that you joined us as Chief Clinical Officer.
Yes.
I think one of the main prerogatives of why you joined us, and I'd love to hear your perspective, but is to take the care delivery models of peer support and continue to push them to be truly cutting edge, to drive like real, robust population level health outcomes. Because I think, to your point, this seems like one of the avenues by which we can scale more provider supply. So like, one, why did you join me on this wild adventure? And two, what is your like vision for the future of peer level interventions? Like, what are you excited to build? Tell me all the things.
Yeah. Wow, that's a really big, meaty question. Okay, why did I join you in this? Number one, I only want to be doing things that I really truly believe in. And I really truly believe in the power and the importance of human connection and relationships. So that's first of all. And anything that I can do that amplifies or brings that mission forward, I am about it 1,000,000%. But the real reason, and I think that this sits underneath all of the work that I do, is I really want to be of service to people. And the way that I do that is by using any strategy that I can with a lot of pace. Oh my goodness, Patrick, I love all my academic friends. Anybody from Yale listening to this, I love you so much. I love the knowledge production. It's all so, so important. We've got like incredible implementation folks. Sometimes things move at a pace where you're like, I don't really want to send this to the forms committee. Like, let's really get into it. Let's try some things out here and get it moving. So the other thing that really excites me about some things is, number one, I think it's really aligned with this idea of, getting back to the basics of what makes us human, which is like relationships and connection. Number two, we're moving with a lot of pace, but very, I think, intentional pace, right? Around how do we use what we best know about the science of peer support? How do we use what we also know intuitively about like the humanity of peer support? And part of how we've done that is we've been really thoughtful about like checking in with people with lived experience to help co-create and co-design and think that through. I think that's fundamental. So working with the pace, working very intentionally, really including the voices of people with lived experience are part of the reasons why I'm very, very excited about some things. And here's the other thing. I love a little technology moment like the next person, right? Like if we're going to use technology, I want it to be working on behalf of us and what we think is the most important thing to have happen, instead of like, okay, actually somebody incredible, their name is Andrew Chang, I should say, and they have a nonprofit that does international peer support for folks. And they said on a call recently, and I hope it's okay for me to steal this, but they were like, how a lot of times people are like, AI is coming. It's coming. It's here. There's nothing we can do. They want the next sort of call to action to be peer support is coming, right? Connection, relationship, getting back to the basics of humanity is coming. And it is up to us to understand how to receive it and how to platform it and how to make it work for every single young person who deserves that opportunity. So that's why I'm here. We're going to do all of those things together, which I'm so, so pleased about.
So the question I end all these podcasts with, we'll jump there, is like, if you had a magic wand and you could wave it and change anything about mental health, youth mental health, or the world in general, like what would your magic wand be?
I think a lot of times I find that I'm in a very solution-oriented space, which is to say that I'm often thinking about what the problems are. But if you were to like just talk to me on a regular basis, part of what I'm really interested in actually solving for is like, how do we just experience joy and vitality? I feel like that is one of my core missions, which sounds very like maybe a little too like in the clouds or something. But I've said this before, that I feel like the ability to experience joy is like a birthright that we have. And so if I had a magic wand, it would be to help people to access that experience of vitality. And in order to really do that, if you really unpack it and think about it, well, then we would need to solve some of these challenges around access. We'd have to really think much more about the sort of structural and systemic analysis that's there. We'd have to really get clear all as a human people about what we're thinking about, how we treat each other, how we move in the world, like that context stuff that we talked about. So it would mean that we've solved a lot of those issues, which would be awesome.
That would be
to
awesome.
The extent that we can't do that, I think that there are also pockets of joy that I search for and have the luxury of experiencing on a regular basis. And so when I can like see that in other people and create a context that allows for that, even in a moment for someone, that's exactly where I want to be.
Amazing. Thank you for everything you do, have done,
Welcome.
and are going to do for the world, because you are such an amazing and special person. And I'm so thrilled that I get to be a little part on your journey.
Oh,
So
Patrick, thank you. Thank you so much.